from our point of view within Core Plus, we provide a client booking framework that is separate and distinct from our customer's website. And so that means that if they're using offshore technology for websites, as an example, it kind of doesn't matter, because as soon as the patient or the client enters the booking experience, they're entering the Australian environment, the Core Plus environment. It's all locked down. It's all very secure. And it gives them a quality framework then to be able to share healthcare information, care plans and the like, and make those appointments and get that confirmation SMS going out for the authentication around the booking and what have you. So we take that really seriously. But then there's another side as well, which is it's one thing to do the client engagement, but then you're sharing healthcare information from provider to provider. And you made a comment earlier about email, and I'm glad you brought that up, because obviously it's a pretty universal communication technology, very effective, but not very secure. And when we're dealing with healthcare information through that medium, that can be problematic in terms of who could intercept it, as well as who could receive it inadvertently. So in Australia, we've developed some standards around how we actually share healthcare information between different points of care. And I think that's important to know, because it's kind of understated. There's a lot of it's more obvious to think about cybersecurity around the business, but not so much, and the customer, but not necessarily think about it as well from business to business, what actually happens in that kind of communication. Are you seeing any major trends in healthcare at all in this particular area?
Yeah, absolutely. This is another area that businesses have had to really quickly adapt this year. Even if you think about GPs writing scripts and then having to send that to a pharmacy directly because they actually haven't seen the patient in person. Certainly at the start of this year, we were seeing most of that occurring via email, which is a really big issue. And I wouldn't be surprised if in not too long we'll be hearing about breaches that occurred back at the start of this year, because that was the way that those scripts were transmitted. But like you say, there is software like Core Plus and many of the other tools and services that can help you connect to other healthcare practitioners and transmit those details securely. And I would highly recommend, if you're not aware on how to use those tools, find out, search for assistance so that you can learn how to use those features, and then also teach your team, and then also encourage those other healthcare practitioners that you work with to do the same. So there is nothing wrong with you insisting on only using particular processes or services to transmit patient data. There's nothing wrong with that, and in fact, as a patient, I would expect that to be the case. It's just about making sure that you can be confident that if there is an error, you have done everything that you can do to protect that information. And like you say, when there are services and software like Core Plus that have this built in and make it easy if you know what you're doing, then it's so important to use those features that are made available.
Well said, Susie. What do you see? What do you see the future of cybersecurity? What's it look like for you in 5 to 10 years?
Yeah, I think in 5 to 10 years, I hope to see a real step change in cyber culture within businesses. So we've already seen the beginnings of that with COVID-19 changing the reliance on technology and changing perceptions over security and risk generally. And I think over the next 5 to 10 years, seeing customers becoming more demanding in terms of wanting reassurance that service providers are keeping their information secure. But also I think we'll see some of these friction points and questions over convenience versus security dissolve, because that's simply just not the argument that needs to be had anymore. I think as more and more people are growing older with technology at their fingertips, more and more people are sort of in society that understand that this is something that they need to think about. I also think we'll see a massive improvement in the number of security features within software that is turned on out of the box. I mentioned before about how many of these features are not enabled and you need to go hunting for them and turn them on. I think as customer and consumer perceptions change and challenge some of those assumptions that are made behind those decisions, I think we'll see more and more of those features just turned on out of the box. And the more that happens, the easier it is for people to change their behaviours and adopt things like multi-factor authentication. I remember when that was first released 5 years ago or thereabouts when I first encountered it, I thought it was a pain in the backside. And now I get nervous when I'm not using it. So I think we're going to see those sort of changes across, particularly consumer-driven changes across the security of services into the future.
Yeah, it's definitely not going to get less of a priority. It's going to be increasingly more of a priority. And the Australian Privacy Commission has already flagged they're doing consultation with industry at the moment. There's, I think, at 21, 22, there's going to be more reform in the way the Australian Privacy Act, the APPs, as well as Australian consumer law. They're actually, doing a sort of a amalgamation of key things that consumers need protection for. So there'll be more reform hitting us over the next couple of years. And COVID-19 has been a bit of an accelerator for that as well. But so does globalization. Oh, sorry, Susie.
I was just going to say, adding to that as well, certainly mandatory standards and compliance regimes are on their increase. We're already seeing that. So there are already federal government programs. One from the top of my mind that comes up is Right Fit for Risk, and that's a compliance program that's being applied to consultants and small businesses working within a particular federal government program. And so we're going to see more and more of these mandatory standards and compliance requirements and obligations being placed on small businesses. In the past, there was a feeling of we won't apply that to small businesses because we know that they don't have the resources, etc. Whereas now, because of consumer perceptions changing, everybody knows that that's no longer an excuse. And so having the ability not only to protect your business, but then demonstrate to somebody external to your business that you are doing the right thing, that's certainly going to be a growing need, particularly within healthcare. That's going to be one of those industries that feel the effects of these sorts of compliance regimes sooner rather than others.
Absolutely. All the more reason to develop a alliance with Cinch Security in that context, because our conversations flowed really organically, but I just wanted, just before we finish up, I really want to emphasize that you've got a very innovative business model in the sense that you're providing a managed service, which turns it into a subscription so that the customer can actually subscribe to the Cinch Security managed service experience, get access to those analysts, have a nice convenient number in the budget. That's just a recurring payment, so to speak. And I think that's really key. And I want you to talk about that a little bit because I feel like I'm into it. I believe in it. I think it's the right model, and it's better than that time and material kind of traditional consultation model that was very hard to access because of those barriers. But tell me more about the managed service.
Yeah, that's right. So it is software as a service, and how we do it is it's really about recognizing which features businesses of different sizes need. So as with most subscription models, we have 3 different tiers that you can purchase. The first tier is really based on those sole traders or sole practitioners or perhaps partnerships. So you're talking 1 or 2 people. And in those relationships, you don't need some of the reporting capability or the ability to demonstrate and collaborate internally, because usually it's just you or one of you that is responsible. So that's our lowest tier. The middle tier is aimed at businesses of around about 5 people. You might start to need a little bit of reporting. You might actually have a board, a small board that you need to be able to report to. So some of that reporting feature is introduced then. And also, of course, the ability to train staff is also introduced in that tier. And then our top tier, which is still very affordable, it's less than $3,000 a year. This provides you with all of the tracking against particular compliance standards. It provides you with regular phone calls or what we call cyber coaching calls with the members of our team, so that you have somebody to ask questions for. You get board and executive reporting, and we've just also introduced benchmarking as well. So they're all the sorts of features that a business of, say, 20 people really need to be able to feel confident that they're getting the most out of their system. The way that we manage that ongoing support, because we don't at any point take over control of your systems and computers, you always keep control of your own systems. The way that we support that is to work collaboratively with your outsourced IT support provider. So if you already have an MSP or managed service provider on the books, you can invite them into the platform, and then they can actually complete actions on your behalf. And so that really enables this tripartite relationship with, we're not looking to replace any of the people that you already know and trust within your business. We're looking to help everybody to work together to improve the security of the business. And that means being able to provide the right people with everything that they need. And it's going to be a little bit different for a sole practitioner than it is for a business of 20 people.
Yeah, absolutely. And I think a lot of managed IT support companies out there would appreciate working with a specialist in the cybersecurity realm, because it really is a specialized area, and it's very fast paced. There's a lot of changes happening in the space. So I would argue it's harder for a general IT management sort of company to stay on top of everything. And that would be for the bigger healthcare providers anyway. But I think for those who don't have an IT partner in place, to be able to subscribe to one of your plans and be able to get access to guides, to policies and procedure templates, to a fitness plan, that cybersecurity fitness plan that you can iterate on and do at 5-minute intervals and progress towards your goal. Know that you know where you started and where you finished up in terms of the scoring, and just feeling that sense of comfort that you're actively now working on cybersecurity as part of your culture. Getting access to your boot camps, getting access to training to support the team, and get the human side of security, cybersecurity working as well. I think it's a really innovative and solid model that you've developed there, Susie, and which is why I wanted to get you on and have a chat about it, because I do think that cybersecurity is kind of out of sight, out of mind. But when we think about designing digital healthcare experiences, we think about the way that digital health interventions and digital health therapeutics and concepts like secure messaging and a whole bunch of stuff that is evolving within the health tech sector, it goes towards providing a quality framework, a quality system for healthcare to be able to support Australians with their healthcare services, and keep the data safe, which in turn keeps the relationship with the client safe, which in turn supports the human outcomes